The role of biomarkers is quite diverse. During the BHH, I will talk about the markers present at diagnosis and also minimal residual disease as biomarker. Currently, the classification of AML is purely based on molecular features of the acute myeloid leukemia, and they have been summarized in the ELN 2017 risk stratification, which is a combination of cytogenetic and molecular aberrations that classify patients in 3 risk categories, so a favorable, an intermediate, and an adverse risk category. And whereas at least in the HOVON clinical trials, the patients in the favorable group will receive either chemotherapy and autologous transplantation. The patients that carry adverse biomarkers, and again, pure molecular, will receive an allo transplant, so they are treated more intensively. And what I will try to highlight actually is that the ELN risk stratification is currently being updated. So the current markers are being reviewed, and there are some novel features that we may also want to see in this revised version of the ELN recommendations, and those are CBP alpha, mutations in CBP alpha, which are included in the ELN 2017 currently already, but there is some data that shows that not the double mutations, but maybe the BZIP type of mutations in CBP alpha may be a favorable prognostic marker. And on the other hand, TP53 mutations have been shown also by us to be a very important marker with a very adverse clinical impact on patients carrying these mutations. So maybe we should treat those patients as a separate group or separate entity. And there is data around that shows that we may want to include those mutations that are often found in secondary leukemias, and we call those secondary type leukemias or secondary like mutations that also generally have a poor impact. But those are all to be included in the revised version of the ELN recommendations.